Loneliness. There are multiple ways we see loneliness, and based on thousands of assessments we have done, I want to share some insights with respect to presenting problems such as complex trauma, post-traumatic stress disorder, major depression, as well as borderline personality disorder. Unfortunately, loneliness is not understood both by the person who is experiencing it as well as people who assess it. And some of the examples we have seen is, oh, you stay alone, so you're lonely. The problem is not that. The problem is in the middle of the crowd, the person is feeling lonely. In the middle of the family, fully supportive family, as per family members, the person feels lonely. This is the problem. And our research has identified, consistent with global research, that loneliness is rooted in similar experiences in the middle of a chaotic household, dysfunctional family, abuse, neglect, and the child feels isolated. Child perceives, I don't have social support, feels lonely, and this manifests and continues to remain so while growing up. Now, back to the topic, what we wanted to talk about is that loneliness is linked or strongly associated with adult feeling or experiencing or manifesting borderline personality disorder, depression, some level of anxiety. Individuals who have post-traumatic stress disorder also have strong experience of loneliness. And finally, complex PTSD also has association with loneliness. Now, the assessment, and I'll share some of this broadly because it's not yet published, is that the loneliness increases as we go from people who are healthy. They have acceptable levels of loneliness. From there you go into person having depression, cutoff for depression or higher, feel lonely. Then you go to major depressive disorder, loneliness increases. Similarly, somewhere on the way is post-traumatic stress disorder, where loneliness increases. However, in both BPD and complex PTSD, loneliness is very high, extremely high levels of loneliness, and that also is associated with depression. So the depression levels are also high here. So I hope this gives you a perspective on how loneliness manifests and is core to some of these disorders. And the question to be asked here is not what's wrong with you, what happened to you while you're growing up, what experiences started to feel like isolation, social isolation, perceived lack of social support. And once we understand and address that feeling and bring in to the current situation, it is much easier to address that perceived or psychological loneliness.